Do you know what COPD is and how it affects people? COPD, an acronym that stands for chronic obstructive pulmonary disease, is a progressive lung disease that makes it increasingly difficult to breathe. Imagine a normal, healthy lung as a new, unobstructed airway. Now picture that over time this airway becomes narrow and clogged, a bit like a pipe filled with sludge. That's what happens with COPD. This condition is primarily caused by long-term damage to the lungs, usually due to smoking or prolonged exposure to certain harmful particles in the air. These harmful particles could include dust, chemical fumes, or air pollution. Over time, this exposure causes the airways and air sacs in the lungs to lose their elasticity, become thick and inflamed, or get destroyed altogether. So with COPD, the lungs are not able to work as well as they once did, leading to difficulties in breathing. Now you might be wondering, how does one get COPD? Well, the primary culprit is smoking. Yes, you heard right. Smoking is the leading cause of COPD. This includes not only cigarettes, but also cigars, pipe tobacco, and exposure to secondhand smoke. But it's not just smoking. Exposure to certain gases or fumes in the workplace can also lead to COPD. Industries like mining, construction, or manufacturing, where lung irritants are prevalent, pose a significant risk. Now let's talk about the wild card in the mix: genetics. There's a rare genetic condition called alpha-1 antitrypsin deficiency, which makes some people more susceptible to the disease. Though it's less common, it's worth mentioning because it underscores the fact that COPD can affect anyone. While not everyone who smokes or has exposure to lung irritants will develop COPD, these factors significantly increase the risk. So what are the signs that someone might have COPD? Well, the first major symptom to look out for is a persistent cough. This isn't your regular run-of-the-mill cough that clears up after a cold. No, this is a cough that lingers, often producing a lot of mucus, sometimes referred to as a smoker's cough. Next, there's shortness of breath. This isn't just feeling winded after a run. People with COPD often struggle to breathe even during simple daily activities, such as walking or dressing. Then we have frequent respiratory infections. Those with COPD may find themselves catching colds, the flu, or pneumonia more often than others. Finally, there's fatigue. It's not just about feeling tired. It's a deep, overwhelming fatigue that doesn't seem to improve with rest. Remember, these symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time. If diagnosed with COPD, what treatments are available? This is a question that undoubtedly comes to mind for many. While it's true that there is no cure for COPD, there are various treatment options available that can help manage the symptoms and slow the progression of the disease. Medications are often the first line of defense against COPD. Bronchodilators, for instance, can help relax the muscles around the airways, making breathing easier. Inhaled steroids can reduce inflammation in the airways, while antibiotics can be used to combat bacterial infections that often exacerbate COPD symptoms. For more severe cases of COPD, oxygen therapy may be recommended. This involves supplying the body with extra oxygen, either through a mask or nasal prongs, to help alleviate the difficulties of getting enough oxygen from the air alone. In some cases, surgery may be an option. Procedures such as lung volume reduction surgery or a lung transplant can greatly improve the quality of life for those with advanced stages of COPD. Beyond these medical treatments, there are also numerous lifestyle changes that can be beneficial for those living with COPD. Smoking cessation, for example, is absolutely essential. Smoking is the leading cause of COPD, and continuing to smoke will only further damage the lungs. Regular physical activity can also be beneficial, as it can help strengthen the muscles used for breathing and improve overall lung function. A healthy diet can boost the immune system and help the body fight off infections. Pulmonary rehabilitation programs are another potentially beneficial treatment option. These programs typically include exercise training, nutritional advice, and counseling, all designed to help those with COPD live as fully and comfortably as possible. It's also worth noting that mental health is a crucial part of managing COPD. This disease can be taxing both physically and emotionally, so seeking support from mental health professionals can be immensely helpful. Finally, it's crucial to have regular checkups with your doctor if you are diagnosed with COPD, as managing this disease requires ongoing care. No two COPD cases are exactly alike, so it's important to work closely with your healthcare provider to develop a personalized treatment plan. COPD progresses through 4 stages, each with its own set of challenges. Picture it as a journey that starts with mild and ends at very severe, with each stage bringing a new set of symptoms and impacts on daily life. Stage 1, the mild stage, is often overlooked. People might notice a persistent cough or some shortness of breath, especially after physical activity. However, many dismiss these symptoms as signs of aging or a smoker's cough. As we move to stage 2, or the moderate stage, the symptoms become harder to ignore. Breathlessness becomes more frequent, even during mundane tasks, and coughing episodes may increase. People in this stage may also experience frequent colds or respiratory infections as their lung health deteriorates. Stage 3, the severe stage, is where the condition starts to take a significant toll on daily life. Physical activities like walking up the stairs or even getting dressed can become exhausting. There may also be periods of fatigue and wheezing. The journey ends at stage 4, also known as the very severe stage. Here, the symptoms are intense and constant. There may also be episodes of acute COPD exacerbation, where symptoms suddenly get much worse and hospitalization might be necessary. But it's not just the physical symptoms that make COPD a challenge. The emotional toll is equally significant. People with COPD often experience feelings of anxiety and depression. The fear of not being able to breathe can lead to panic attacks. The physical limitations can cause feelings of frustration and sadness. It's a mental struggle as much as it is a physical one. However, it's crucial to remember that COPD is not a death sentence. It's a condition that can be managed. With the right treatment plan, lifestyle changes, and emotional support, people with COPD can lead meaningful and fulfilling lives. It might be a challenging journey, but it's one that doesn't have to be walked alone. Living with COPD can be challenging, but with the right care and support, people with this disease can lead fulfilling lives.